You live with diabetes on a day-to-day basis, and it truly is a pain in the backside, to put it mildly. That it's hard. You have to take care of every little thing that you're doing. Somebody's telling you that you need to exercise, somebody's telling you that you need to watch what you eat, and you built a lifestyle that is hard to change. For years, you've been doing things in a certain way. So how does one stick with it? There are many different techniques that people can use, and each individual is an individual in themselves. So we can't sit there and judge and say that everybody should be walking 30 minutes a day, 5 days a week. That's the recommendation. What if you're doing 2 jobs? You just don't have the time to do that. How do you get to doing these things? Now you realize that if you don't do those things, your blood sugars are not going to be under control. Since everything is working on a calendar, one of the things that one of my patients taught to me was he used to bring in his BlackBerry, and he used to show it to me that on his BlackBerry, on his calendar, amongst all of his other appointments, was scheduled an appointment for himself to go and exercise. So that was one of the things that this patient of mine used to do. And he was very successful at that. And he said to me, you know what, doc, if I don't put this on my calendar, it ain't happening. So you have to realize that there are certain things you just have to do. And when you do those things, you're going to feel better. Let's say you're 20 pounds overweight. Let's turn that question into, you were not 20 pounds overweight, but I told you, here's a sack of potatoes that weighs 20 pounds. Now carry this with you day in, day out, day in, day out. You'd find that extremely hard to do. So you would find every possible way not to carry that sack. So the way to think about diabetes is, if I've got to lose 20 pounds, how much better am I going to feel? How much easier is it going to be for me? So what is it that I need to do to take care of myself? And if that means scheduling exercise for yourself, then I think you should go ahead and schedule exercise for yourself. Then you say to yourself, okay, there are certain medications my doctor said that I'm taking will actually help suppress my appetite, but I forget to take it. Well, then you go and eat, right? Then you go and eat, and that doesn't help you. So you have to ask yourself the question, is this important enough for me? Remember who's in charge here. You are in charge as the patient. You're in charge as the person dealing with the problem. So you have to find solutions for yourself. What works for one might not necessarily work for somebody else. Some people go into yoga. Some people go into transcendental meditation. Pick the tools that work for you. But you have to find the solutions for yourself. There are a lot of solutions out there. Find the solutions. In work, if somebody gives you a task to do, as much as you might hate that task, you do accomplish that task because your job depends upon it. Well, here your life depends upon it. So I think it's really more important than anywhere else that you have to find a solution for yourself. And that's where your physicians, that's where your diabetes educators, they all come and help you.